Today we are going to do a case of avian bilateral hip joints, and what we are going to demonstrate here is we'll do a core needle decompression and then we'll inject the BMAC into it. So you can see the X-ray here, both the hip joint on the X-ray wise, if you can see, it is grade 2 or early grade 3 if you can say, but the contour of the head is well preserved on the both the sides. Patient is 36-year-old male and he is having more pain on the left side in compared to right side, and patient is having these symptoms since last 3.5 to 4 months. Gradually the symptoms increased. Initially the patient was diagnosed to have low backache and PIVD, but on MRI things got confirmed. You can see the MRI picture also that the head is not collapsed in here, but there is definitely geographical areas, and if you can see, or in the MRI on the left side it's little grade 3 if you can see, in comparison to the right. Left is more damaged, and hence the patient is having more pain on the left side. But since the patient is very young and active farmer, he don't want to undergo hip replacement surgery at this time, and we also think that if the contour of the head is preserved, we should give all the efforts to save the joint. Okay, so now initially our first step will be the harvesting of the bone marrow, and we will approximately 120 to 140 ml bone marrow we will take from both the iliac crest, and then we will process that into the Arthros agile system. This will make the cells and will separate the bone marrow concentrate from the bone marrow, and then we'll inject it into the joint percutaneously under the CM guidance. I'll show all the things step by step. So let's see. Patient is under spinal anesthesia, and we'll do the procedure now. Rinsing all our needle and syringes with the heparinized solution so that things do not get coagulate while we harvest the bone marrow and other things. Okay, so vacuolox. This is the vacuolox syringe, and we create a vacuum and lock it so the vacuum will be created. I'll show you how to use it. And now we will harvest the bone marrow from the anterior iliac crest. So after proper draping and painting, we'll identify iliac crest. From 2-3 points we can take the bone marrow. So I'll make a stab incision up to the bone, and well rinsed Jamshedi needle with the side bores. You can see there is side hole also in this needle. One to 2 centimeter you inject, put it directly, and then take it out and clear, and then you put a vacuolox syringe, lock it well, and create a vacuum in it. Now you can see the vacuum bone marrow started coming gradually. We'll see it till how much time it is coming gradually, and once it stops we can change the direction of the needle, we can change the location of the needle and get more bone marrow aspirate. So meanwhile it is coming, I'll inject it, do it from the other side. Give a stab knife incision. This in a vacuum oxygen, there is a 4 ml of ACD solution. So I'll show you, I'll tell you. Yeah, this is a good speed in which you can say the marrow is coming. Not too much from the same side, I'll take rest from the other side. Different settings can be adjusted. We have selected that we will collect 150 ml of bone marrow and then we will separate it and make a concentrate. So here it is 150. This hematocrit is going into the chamber, so this is gradually increasing. This is 45, 46, this is in the ml, and this is the cycle. How much time it will going to take is mentioned over here, and this is the sign of the PRP which will get into this needle. Automatically once the process is done, the PRP will get separated, the RBCs will be settled down somewhere here, and the PPP platelet pour plasma into this chamber. So this whole process is completely sterile and a closed system. We need not to interfere, we need not to do any changes in it at this moment. You have to just inject the bone marrow and set how much volume is here and then just start it. So now this needle is hitting the bone, okay, and you can see the image there. Now by to and fro motion, I am introducing the needle into the head. Now you can see approximately 1.5 centimeter needle is in. Shoot it, and you can see the image how much the needle is advanced from the bone and into the bone. Now at this point I'll inject some amount of dye to ensure that my injection spread is how much. You can see the darkness which is increasing in the head. Okay, so now I am injecting some more dye. You can see this, how the drug is dispersed well into the head. Okay, so now this is the position. In this I am going to inject my bone marrow aspirate concentrate through this needle, and I'll just keep it closed and will mark the opposite other side. Bone में touch होने के बाद की image है. This is then bone में touch होने के बाद we have introduced by through and fro motion into the head. So approximately 1.5 centimeter is into the head, and then I have injected the dye, and the dye is spread well into the head. Okay, so somewhere from the intertrochanteric ridge, or you can say from the neck side, we start progressing the needle. Okay, shoot, and it will go and hit the bone. So now it is hitting the bone. Shoot. Okay, so I just want to shift it little more superior. Shoot it. Okay, so once it is hitting the bone, and I am going to go into the bone intraosseous. This is going intraosseous. You can see the needle is gradually progressing. You can see it on the skin how much you have gone in. You can see the difference. Now I'll put some dye. So now shift that image into the right side. Okay, so this is without dye, and now we'll inject the dye into that. Okay, shoot. You can see this. You can see the dye is spread into the area. Shoot. Simply by doing a puncture into the bone marrow, into the femoral head, you can decompress it. The main aim of pore decompression is to release the raised intraosseous pressure from the head, and that pressure can be released with the help of single needle also. So you can use this 18 gauge spinal needle, or you can also use 14 gauge needle, or sometimes some people also do decompression with the Jamshidi needle also. So that can also be done, but aim is to decompress the pressure, release the pressure which is increased into the head of the femur, and that thing is clearly evident with the pain relief which the patient get very next day. Takes a lot of pressure to inject it.